Welcome to the Uzima Health and Wellness Podcast. What did the doctor say?
That's very important because for the most part, if you're not as a family presenting your child to a place that recognizes sickle cell disease, can you talk about some of the challenges these families have with getting their children care if they don't run into someone like yourself or into a center like the University of Texas Children's Hospital? And they're fortunate to have this type of compassionate care and knowledgeable care about sickle cell patients. What are some of the challenges?
That would take another hour to talk about. But I'm fortunate and somewhat biased that, again, I've trained in all of these places, and my entire career has been in these places where is so much sickle cell. So sometimes it's hard for me to imagine that there are many hospitals and even the majority of emergency rooms in the country, there are people who have not seen a person with sickle cell disease regularly. So sickle cell disease can actually begin to manifest as early as 6 months of age, and sometimes earlier. Often the first manifestation is pain, some form of pain. And so these infants, they need pain management that's appropriate for sickle cell disease, just as any other child with sickle cell disease, or child or person with sickle cell disease needs. So I always encourage the patients who see me to, if they need help, wherever they are in the country, wherever they are in the world, before they go to an emergency room, call me. And let me know where they're going so that I can I can assist the person that it might see them if they're not familiar with sickle cell disease. I can't tell you how many times I have very knowledgeable, well-intentioned, well-meaning providers say, "Can I really give morphine to a 1-year-old? I don't really feel comfortable with that because I haven't done it." And I say, that's what they need. It's safe. It's what they need. And so, empowering parents also to be able to advocate for their children in that regard is really important. But then having that physician partner or that healthcare provider partner to help you advocate is incredibly important.
So
now,
I'm sorry, go ahead.
So imagine then, you have a disease that unfortunately the best treatment that we have for the main manifestation is opioids. In the current, you've had that, you have patients who have, for whom their bodies have been seeing opioids for 18, 19, 20 years, going to adult emergency rooms. And in many cases, these patients are more knowledgeable about opioids and the side effects and how it works on their bodies than the providers that they're seeing. In our current, it goes without saying that many of these patients are Black and brown.
Correct.
So you take all of this this situation and it's yielded an enormous amount of discrimination against adults with sickle cell disease who present to the emergency room for pain.
Hi, Uzima family. If you like what you're seeing and what you're hearing, subscribe to our channel. Hit the bell icon below to be notified of our recent videos. What the doctor say?